Yeah, unfortunately, I think that is a worldwide phenomenon, and one that needs to be countered with good information. I think, it really is urgent now to make sure that we get good information out to people as to what the vaccine is, how it works, and what its benefits are.
With a lot of people asking whether it might be necessary to make the vaccination mandatory, what will be needed to achieve herd immunity, so to speak, and why would that be important?
Yes, so listeners will have heard the webinar on Sunday where Professor Barry Shube was discussing a sort of 2/3 coverage in order to reach this important concept of herd immunity. What that means is where there are sufficient numbers of people in the general population who are immune, such that we reduce the amount of virus that is transmissible. So, in other words, you start to benefit. Even if you are not immune, you will benefit from others' immunity. So you get this kind of effect of a mass immune function. And that is one of the great benefits of vaccines, is that others who may not actively become vaccinated can actually benefit when there is sufficient of the population that have acquired immunity. So we want to get to that point so that anybody who might have fallen through the cracks will still be protected. But it does mean we need the vast majority of South Africans to step forward when the opportunity comes.
With the other South Africans not really looking forward to the vaccine and asking a lot of questions and not sure what's in it, what would you say is perhaps the information that needs to be sent out there to make sure that everyone is on the same page when it comes to the vaccination and the contents of this vaccination?
Well, I think, like everything, we need a mass campaign of good information. There are a number of myths out there. Some of them are a little more far-fetched than others. Some are genuinely just good questions that need good answers. And I think South Africans have done this in the past. We had a lot of questions, for example, around antiretrovirals. When we first started to move antiretrovirals into the public space, a lot of people were concerned about toxicity, about implications of pharmaceuticals. We're in exactly the same position again now. And what was incredibly important at that time was this notion of community information dissemination. So this should not only be in the hands of government. This needs to be something where the population at large makes itself aware, and then we have really very active community advocates going out and making sure that good information is shared at every single opportunity. When we're sitting, at the waiting room at a clinic, we share good information. When we talk to a friend on the phone, we share good information. We make sure as many people as possible hear the right information. Too often, what holds good health back is wrong information or myths, which we have to counter with good information, with the right information. And
And
that's urgent now.
and what exactly is the right information, as well as, dismissing the far-fetched myths that you speak of? What are they?
That these vaccines have, although they've been developed quickly, it doesn't mean we've cut corners. The vaccines that are receiving regulatory approval, that are being rolled out, for example, in America and in Europe now, that have had FDA and EU approval, UK approval, they have been properly investigated in good scientific clinical trial conditions. That means we've looked at the safety and we've looked at the efficacy. And now they are safe and efficacious and therefore can be rolled out into the public. They are vaccines the way we understand, you get a measles vaccine or a chickenpox vaccine. They work on exactly the same principle. They do not cause the disease. They stop the disease by getting the immune system worked up, our own immune systems, to counter the infection. And that essentially is all that anybody really needs to know. Obviously, it is also important to warn people about the mild side effects that can be expected, so individuals are prepared. And, you know, anybody who can get online can see now those individuals who are lucky and are accessing vaccines at the moment. Many of them are taking the trouble to share what experiences they're having. And by and large, from what I've seen, most of it is very mild side effects, a sore arm, maybe feeling a little bit fluey for a day or so, and then moving on with their lives quite effectively. And so that, in a nutshell, there may be 3 or 4 important facts we need to make sure that every single South African hears, and we need to encourage South Africans to take this up as a good personal health intervention, not only for themselves, but also for their families and for the people around them, because we want to reach that herd immunity status. And I would absolutely concur with the president. This should not be compulsory, but I would really encourage every single South African to feel excited about getting vaccinated as soon as they can lay their hands on a vaccine.
Professor Bekker, well, some people have, spoken, a lot of people speaking about how the intent is commendable, but it must be balanced against raising false expectations, especially when it comes to the non-pharmaceutical interventions.
It is a true fact that until the vaccine is actually in your arm and you get immune take, in other words, your host immunity is stirred up and you move into a place of protection, the vaccine patently is not working for you. So until that point, you need to still protect yourself against the virus. And, again, it sounds boring. We've said it so much already, but it really is about shared spaces, crowded environments, and close encounters. We've got to make sure that we protect ourselves from exposure to individuals who might be COVID positive. And those individuals are not always symptomatic. They're not always in hospital. They're not always sick. So those are the considerations we are all going to have to carry around with ourselves until the herd immunity aspect kicks in, and we start to benefit the way we do, say, from measles campaigns, where enough people are protected against measles so that we can feel confident that we are not going to get measles when we go out into the public domain. We have to get to exactly that place, and it is still some months away. Until that point, I'm afraid it's pharmaceutical interventions are all that we have up our sleeve to protect ourselves.
Very well. Thank you so much for your time.